of the questions is, why is it important to know your weight, your blood pressure, your cholesterol, and your blood sugars? The reason for this is that if you don't know your numbers, you're not going to know how healthy you are and how healthy you have to keep yourself. So for instance, if your weight is supposed to be 130 pounds and you never weigh yourself and you never check it, it has a high tendency, particularly if you snack a lot and don't monitor your diet, to continue to gain weight. And before you know it, you've gained so much weight that it's very, very difficult to lose it. So in order to be conscious about your weight and remain healthy, you have to keep an eye on your weight. You have to weigh yourself routinely. If you want to do it once a week, you can do that, but at least have a certain routine where you know a certain time or day that you're going to check your weight, and then monitor that based on what your ideal body weight is supposed to be. The second thing is your blood pressure. So you have to know what your blood pressure is, because I have patients who come in and tell me, I haven't checked my blood pressure for 6 months and now it's 180/90, which obviously has started to cause some damage on their internal organs. So make sure that if you have a family history or if you have a tendency to have high blood pressure, you check your blood pressure and keep an eye on that. Normally your blood pressure should stay below 130 for the top number and below 85 for the bottom number. So as long as you know those numbers, you need to keep a close eye and make sure that it stays under control. The third is your cholesterol. Especially for patients with heart disease and those patients who have a family history or have other risk factors for heart disease, cholesterol is a key component of your risk factors. So your total cholesterol should be looked at. It should be less than 200. Your bad cholesterol is called LDL, which is L starting with like lousy. So your LDL is important. You need to know what it is for somebody who has heart disease. And even if you don't have heart disease, you need to make sure that it stays less than 130. If you have heart disease, which means you have previous stents or bypass, it should be less than 70. Your HDL, which is your happy cholesterol, should be high, and it should be higher than 40 for men and higher than 50 for women. So as long as you know these numbers and you keep an eye on it, so when you go to the doctor's office and you get blood drawn, make sure you ask them for the results and know what those numbers are.